8 signs you have cancer and don't know it. Did you know that cancer is the second leading cause of death globally, responsible for an estimated 10 million deaths each year? It's a staggering statistic that underscores the urgency of early detection. Welcome to our video on the silent signs of cancer that often go unnoticed until it's too late. Cancer is a formidable foe, but early detection can be our greatest weapon against it. The earlier cancer is detected, the more effective treatment can be, potentially saving lives and improving outcomes. Today, we're diving into the top 8 signs that could indicate cancer is lurking beneath the surface. From subtle changes in weight to persistent pains and unusual symptoms, these warning signs are often overlooked or dismissed. But by paying attention to your body and recognizing these red flags, you could potentially catch cancer in its earliest stages, giving you the best chance at a positive outcome. So, grab a pen and paper, and let's uncover the 8 signs you should never ignore when it comes to your health. Number 1. Unexplained weight loss. Sudden and unexplained weight loss can be a concerning indicator that something is amiss within the body. While weight loss is often celebrated when achieved through healthy lifestyle changes, unintentional weight loss without changes in diet or exercise could signal an underlying health issue, including cancer. Several types of cancer are commonly associated with unexplained weight loss. For instance, cancers of the pancreas, stomach, esophagus, and lung can lead to a decrease in appetite and unintended weight loss. Additionally, blood-related cancers like leukemia and lymphoma can cause weight loss due to the body's increased energy demands as it fights off the disease. If you've experienced a significant and unexplained drop in weight, it's crucial to seek medical attention promptly. While weight loss can have various causes, including stress, hormonal changes, or digestive issues, it's essential not to dismiss sudden weight loss as inconsequential. Your doctor can perform a thorough evaluation to determine the underlying cause and provide appropriate treatment if necessary. Remember, early detection is key to better outcomes, so don't hesitate to reach out to your healthcare provider if you have concerns about unexplained weight loss. Number 2. Persistent fatigue. Feeling tired now and then is normal, but persistent fatigue that doesn't improve with rest could signal an underlying health issue, possibly even cancer. Fatigue associated with cancer is often described as extreme tiredness that interferes with daily activities and doesn't improve with adequate sleep or rest. It can be overwhelming and debilitating, affecting both physical and mental well-being. Several types of cancer can cause persistent fatigue as a symptom. For example, leukemia, a cancer of the blood and bone marrow, can lead to fatigue due to the body's reduced ability to produce healthy blood cells. Additionally, cancers that affect hormone levels, such as thyroid cancer, may cause persistent fatigue as a result of hormonal imbalances. Furthermore, cancers that have spread to multiple organs, known as metastatic cancers, can cause fatigue as the body's resources are diverted to fight the disease. While fatigue associated with cancer can be challenging to manage, there are strategies that may help alleviate symptoms. These include maintaining a balanced diet, staying hydrated, engaging in gentle exercise or activities that promote relaxation, and prioritizing rest and sleep. It's also essential to communicate openly with your healthcare team about your fatigue symptoms and any concerns you may have. If you're experiencing persistent fatigue that doesn't improve with rest or interferes with your ability to carry out daily activities, it's crucial to consult a healthcare professional. While fatigue can have various causes, including lifestyle factors, stress, or underlying medical conditions, it's essential not to dismiss it as normal. Your doctor can conduct a thorough evaluation to determine the underlying cause of your fatigue and recommend appropriate treatment options. Don't hesitate to reach out for help if you're struggling with persistent fatigue. Early intervention can lead to better outcomes and improved quality of life. Number 3. Changes in bowel or bladder habits. Changes in bowel or bladder habits, such as the presence of blood in stool or urine, can be alarming and may indicate underlying health issues, including colorectal or bladder cancer. Blood in the stool, known as rectal bleeding, can be a sign of various conditions, including hemorrhoids, inflammatory bowel disease, or colorectal cancer. Similarly, blood in the urine, known as hematuria, can be a symptom of bladder cancer or other urinary tract issues. It's crucial to pay attention to any changes in bowel or bladder habits and discuss them with a doctor promptly. While changes in bowel habits can sometimes be attributed to dietary factors or temporary issues, Persistent symptoms such as rectal bleeding or changes in urine color should not be ignored. Early detection of colorectal or bladder cancer can significantly improve treatment outcomes and increase the likelihood of successful recovery. Therefore, if you notice any concerning changes in your bowel or bladder habits, don't hesitate to seek medical evaluation and discuss your symptoms with a healthcare professional. Your doctor can perform diagnostic tests, such as colonoscopies or urine tests, to determine the cause of your symptoms and recommend appropriate treatment if necessary. Number 4. Persistent pain. Persistent pain, particularly if it's localized and worsening over time, can serve as a warning sign of underlying health issues, including certain types of cancer. While pain can have various causes, including injuries or chronic conditions, unexplained or persistent pain that doesn't respond to treatment warrants further investigation. Certain types of cancer are known to cause persistent pain as a symptom. For example, bone cancer often presents with localized pain that worsens over time, especially with movement or pressure. Pancreatic cancer may cause abdominal or back pain that is persistent and unrelenting. Other cancers, such as ovarian or testicular cancer, can also manifest with persistent pain in the affected area. While pain can have various causes, including musculoskeletal issues or nerve-related conditions, it's crucial not to dismiss persistent pain as inconsequential. Your healthcare provider can conduct a thorough evaluation, including imaging tests or blood work, to determine the underlying cause of your pain and recommend appropriate treatment options. Number 5. Changes in skin. Your skin is your body's largest organ and often the first place where signs of health issues, including cancer, may appear. Changes in the skin, such as the appearance of new moles or alterations in existing ones, should not be overlooked. These changes could potentially indicate skin cancer, the most common type of cancer worldwide. Changes indicative of skin cancer. Skin cancer, particularly melanoma, often presents with changes in the size, shape, color, or texture of moles or other skin lesions. New moles that appear suddenly or existing moles that become asymmetrical, have irregular borders, exhibit uneven coloring, or change in size or texture may warrant further evaluation. Additionally, skin lesions that bleed, itch, or don't heal should be examined by a healthcare professional. Regular self-examinations of your skin can be crucial in detecting skin cancer early when it's most treatable. Take note of any new or changing moles and bring them to the attention of your doctor. It's also essential to schedule regular skin checks with a dermatologist, especially if you have a history of sun exposure, a family history of skin cancer, or other risk factors. Early detection and treatment of skin cancer can significantly improve outcomes and reduce the risk of complications. If you notice any concerning changes in your skin, don't hesitate to seek medical attention promptly. Your dermatologist can perform a thorough examination and, if necessary, biopsy suspicious lesions to determine if they are cancerous. Remember, when it comes to skin cancer, early detection saves lives. So, prioritize your skin health, practice sun safety measures, and don't delay seeking help if you have concerns about changes in your skin. Number 6. Persistent cough. A persistent cough, especially when accompanied by other symptoms such as coughing up blood or chest pain, could be indicative of underlying health issues, including lung cancer or other respiratory conditions. While a cough is a common symptom of respiratory infections like the common cold or flu, a persistent cough that lingers for several weeks or months should not be ignored. A persistent cough that doesn't improve with time or treatment, particularly if it is accompanied by other concerning symptoms such as coughing up blood, hemoptysis, chest pain, hoarseness, unexplained weight loss, or difficulty breathing, should prompt further evaluation by a healthcare professional. These symptoms may indicate an underlying respiratory issue, including lung cancer or other malignancies. If you're experiencing ongoing coughing, especially if it's accompanied by any of the aforementioned symptoms, it's essential to see a doctor promptly. While a cough can have various causes, including respiratory infections, allergies, or asthma, persistent coughing that persists for more than a few weeks warrants medical evaluation. Your doctor can conduct a thorough examination, order diagnostic tests such as chest X-rays or CT scans, and recommend appropriate treatment based on the underlying cause of your symptoms. Number 7. Difficulty swallowing. Difficulty swallowing, medically referred to as dysphagia, can be a concerning symptom that warrants medical attention. While occasional difficulty swallowing may occur due to factors such as eating too quickly or swallowing large bites of food, persistent dysphagia, especially when accompanied by other symptoms, could indicate underlying health issues, including cancers of the esophagus or throat. Esophageal cancer and certain types of throat cancer, such as oropharyngeal cancer, can lead to difficulty swallowing as a result of tumors obstructing the passage of food and liquids through the esophagus or throat. Difficulty swallowing may present as a sensation of food getting stuck in the throat or chest, pain or discomfort when swallowing, or the need to swallow multiple times to move food down the esophagus. Difficulty swallowing may be accompanied by other symptoms, including unintentional weight loss, regurgitation of food or liquids, chest pain, or a sensation of choking or coughing while eating or drinking. These additional symptoms may vary depending on the underlying cause of dysphagia but should be taken seriously and discussed with a healthcare professional. While occasional difficulty swallowing may not be cause for concern, persistent or worsening dysphagia could indicate an underlying health issue that requires diagnosis and treatment. Your doctor can perform a thorough evaluation, including imaging tests such as barium swallow studies or endoscopic examinations, to determine the cause of your symptoms and recommend appropriate treatment options. Number 8. Changes in lymph nodes. Lymph nodes, those tiny bean-shaped glands found throughout the body, play a crucial role in the immune system's defense against infections and diseases, including cancer. Changes in lymph nodes, such as swelling, tenderness, or enlargement, could be a sign that the body is mounting an immune response to fight off an infection or could indicate certain types of cancers, such as lymphoma. While lymph nodes commonly swell in response to infections, injuries, or other immune-related conditions, persistent or unexplained changes in lymph nodes should not be ignored. Enlarged lymph nodes that are painless, firm, or fixed in place, especially if they persist for several weeks or continue to grow in size, may warrant further evaluation by a healthcare professional. It's essential to monitor your lymph nodes regularly and be aware of any changes in size, tenderness, or consistency. If you notice any concerning changes, such as persistent swelling or enlargement of lymph nodes, don't hesitate to discuss them with a healthcare provider. Your doctor can perform a physical examination, order diagnostic tests such as imaging studies or blood tests, and recommend appropriate treatment based on the underlying cause of the changes. Early detection of lymph node changes can help identify underlying infections or diseases, including cancer, at an early stage when treatment may be more effective. By staying vigilant and discussing any changes with your healthcare provider promptly, you can ensure timely diagnosis and intervention if necessary. In conclusion, staying vigilant about changes in your body and seeking medical attention for any concerning symptoms is crucial for early detection and treatment. Remember, your health is your most valuable asset, so prioritize it by staying informed, proactive, and attentive to your body's signals. By taking action when needed and prioritizing preventive measures, you can safeguard your well-being and ensure a healthier future.